International Society for Sports Psychiatry, or better known as the ISSP, aims to carry the science and practice of psychiatry to the athletic community. My name is Roy Collins. I'm a psychiatry resident at Stanford University and former collegiate football player from Yale University.
And my name is Somto Obi, a psychiatry resident at Baylor College of Medicine. This is the ISSP podcast, conversations around the intersection between mental health and sports. Welcome again to another podcast. We are with Dr. Bettina Frankel. She is a sports psychiatrist at the Counseling Center at Northwestern University and she's part of the sports psychology team. She has been treating Northwestern D1 athletes for the last 8 years. She's a representative for sports psychiatry in the Association for College Psychiatry and also a member of the International Society of Sports Psychiatrists. Originally from Germany, Dr. Frankel completed her residency at Harvard and Northwestern and is currently a clinical faculty at Northwestern. How are you doing, Dr. Frankel?
I'm doing fine. Thank you for having me. It's a pleasure to meet you.
Thank you, Dr. Frankel. You've been doing a lot of great work, and we're really excited to have you on here to help us on our topic for today, ADHD and athletes. Just to get things started, I wanted to know for, an athlete, say you have an athlete that comes in and, they've never had any, mental health care before, and they wonder, do I have ADHD? What are some symptoms or signs that they might, observe or you might observe that might lead them to this diagnosis?
So athletes are often actually referred either to me, I'm in a college, by the academic advisor. Our athletic department has academic advisors, or sometimes by the athletic trainer and sometimes on their own accord. And usually it's because they have trouble with attention and executive functioning, just like everyone else who has ADHD. And for them, academics are a big part of their life and they have very busy lives. So athletes usually have, I always kind of conceptualize this as 2 full-time jobs. So they have to do their athletics. That's anywhere between, given all the travel and competition and stuff, it can add up to 40 hours a week, but it usually is between 20 and 40 hours a week, even when they are in their 8-hour a week period, because there's always some other stuff added on. And they are full-time students, and Northwestern is a very academically challenging place. So it's usually not being able to focus on classes, getting distracted, and often losing things, missing appointments, being disorganized. Sometimes they keep often several calendars. So there is a thing called Teamworks where the athletes keep all of their appointments. But some academic appointment stuff, some things they have to put in themselves and they get disorganized with that. They might miss important appointments. They might have to ask the housing to key into their room repeated because they lose their room key, or they're often the wild card, like whatever it is that gets them into their room. I have had it that the whole team bus had to turn around because the athlete with ADHD forgot the ID and they were on their way to the airport for a competition. It's often those kinds of things. Sometimes it's also the coaches who say you zone out, or the athlete can't sit still with hyperactivity during film watching, or position group state meetings in football, for instance. So that's often how they come. They feel like there's something wrong, and then when I do the assessment, then you kind of one has to rule out comorbidities, or if they are there, has to treat them too. So for athletes, that's often anxiety, often, they try to maybe work with a sports psychologist on their performance and they are too anxious or too distracted to get to the mindfulness part. So they're trying to do whatever and exercise, and it doesn't work. Yeah.
Okay. Oh, so that, I think you touched on some of the big active symptoms, and then also the subtle symptoms, such as, you've noticed your son or your friend is losing his keys all the time and forgetful. And I think that's really helpful. And I mean, that would also impact how they perform if they're also not be able to, pay attention in, recordings and, film room, and pay attention to like what your opponent's doing.
Yeah, so there's so usually people with ADHD do a little better when their adrenaline is going. So what folks with ADHD often tell you, individuals with ADHD often tell you, is that can't concentrate, and then there's a deadline, and then I'm full of adrenaline, and then I get it done. But it's not as good as it could be because I wasn't able to work earlier. So in the game, in a game or match or meet or whatever the sport is situation, when there's competition, that's often not their problem. But watching film, learning plays, let's say in football or in basketball, or during practice, really concentrating on getting that swim stroke right every time in order to shave off those seconds or milliseconds, or concentrating doing your baseball pitch, like working on your techniques, that's when people when the ADHD interferes. Now, what often is the case is that, if you think of a football player's day, let's say, as a student athlete, they start out very early, usually having a position, either workout, a strength workout, or a kind of a position group meeting, often film watching. Then they have, often they have at some point during the day, like physical practice. And then if it's season and they're preparing for the next opponent, they might even watch film at night, right? So there's several times where they need to concentrate without having that rush of adrenaline with the competition. And especially when athletes are learning plays and they have ADHD, in addition to treating the ADHD, it's often worth talking to the coaching staff about, this is not someone who can just do what you're asking them to do by you drawing it on a whiteboard. This might be someone who needs the movement, who needs the muscle memory, who needs the procedural kind of memory, if you want, in order to perform well. So that's often when, and when I have athletes, some of them like taking their medication when they are playing. And you can imagine sports like golf or fencing, or baseball. And some of them don't. So there have been some studies who say that some athletes complain about losing their spontaneity and creativity. And if you think of, where is ADHD helpful? If you think of a sport like field hockey or basketball or something, or soccer, where you have to have some kind of idea what's going on the whole field, and you need to not just focus, like, let's say as a defender, not to zero in on the one person that is coming towards you with the soccer ball, but you also need to see who else is coming up and how could they maybe pass. And some athletes like it, but some athletes say, no, it's making me a worse player.
Yeah.
And there's a study that basketball point guards particularly, that's the one study that I'm aware of, have said they lose their spontaneity and creativity and don't like it.
Interesting. And yeah, it makes a lot of sense, actually. Because that actually takes me to my next question is, there are the negative side effects of having ADHD, but what could be the positive? It seems like you kind of touched on that already. What are the positives of having ADHD, and can it actually help in some sports or in general?
Well, it is that creativity. A lot of athletes have the advantage of starting really young. We all know that exercise helps ADHD symptoms, cardiovascular exercise. So, when I talk to parents, they often say, well, my child was so hyperactive, and then I put him in, fill in the sport, soccer, swimming, whatever it is, track, and he or she was much better because not as hyperactive anymore, better able to focus. So a lot of these athletes get an earlier start because they you know, if you get put in a sport early and then you have athletic aptitude and talent, then you're much more likely to become good enough to become a varsity student, D1 student athlete, right? Or even D3 student athlete. I wanted to come back to the negative for just a second here. We know that athletes with ADHD, there have been studies, have a higher incidence of concussions, probably because they are distracted. We don't know, but probably because they're distracted, and have a harder time recovering from concussions, and are harder to assess because their impact test, which is the computer test that we use to assess, you know, concussion and is this person ready to return to play, have they returned to their baseline? Usually everyone, at least at our university, I don't really know about others, but everyone gets a baseline impact test, and then they need to return to their baseline after a concussion before they can return to play and practice and so forth. And we know that the return to play takes longer, but that athletes with ADHD, their impact test often looks like they don't put in the effort. And that's probably because of whatever ADHD does to their brain function. So that's a little harder to see, and the recovery is harder, and concussions are more likely. That's a negative there.
Interesting. Yeah, I know, at least in general public, it's like you see more patients with ADHD getting more like car accidents, careless errors. So that I see that's the correlate for in the field. Mm-hmm. So, I mean, the big question too with athletes is, if I start a stimulant, you know, how will it affect me? How will it affect my play? You know, so what have you seen with, you know, when a patient starts a stimulant and plays sports in general?
So I've seen, I think the biggest advantage is that people feel like they can get the academics done in time, so they have more time. I've had it so many times that athletes basically had no social life because between academics taking them much longer than other students that don't have ADHD and having the busy athletic schedule, there's really no time in their day. So when they can get the academic work done a little sooner, they can bond, like in a more reasonable amount of time, they can bond with people and, you know, can have some social life and bond with teammates off the field, outside. And that often helps academic athletic performance too. As a lot of athletes say it for the first time, I can actually remember the plays we learn. You know, I can actually pay attention. My coach finally said, I'm like there. So they, you know, people around them notice. My friends are saying I'm actually not hopping from topic to topic when we have a conversation, but I'm actually able to stick with the conversation. And that goes for, like, you know, talking about your sport too. The problem I've seen is, and that's especially true for athletes who have to maintain a certain weight, but all athletes really need to fuel appropriately, is the suppression of appetite. So it really is important to tailor the regime, the drug regime, to the athlete's schedules. So if I usually start with long-acting preparations. If that doesn't work because the athlete loses appetite and doesn't snack appropriately throughout the day and doesn't eat a decent lunch, you know, then maybe too short acting preparation. It really takes a lot of, like ADHD treatment always does, it takes a lot of tweaking. You know, even in the general population, quite a few people, a significant percentage of students stops taking their stimulant in the first year. And I think that's because it takes some time to find the ideal regime, the combination of long-acting, short-acting, what works. Is it a methylphenidate? Is it an amphetamine? You know, what kind of preparation? How long did it last? that takes some time. So I would encourage athletes who kind of are wondering about that to really work closely with their sports psychiatrist and to anticipate having to to talk to a nutritionist or performance nutrition, have to anticipate having to really work on getting their calories in. So really work on fueling appropriately. Our performance nutritionists often work with our athletes on getting liquid calories, so those higher caloric, protein drinks and those kinds of things, because that's an easier way. But as you know, some people, especially like linemen in football, there are some positions that people just have to maintain a certain weight, and it's really hard.
Yes, thank you, Dr. Frankel. That makes a lot of sense. And I had another question. I was reading the International Society of Sports Psychiatry Manual of Sports Psychiatry. Some of many of the leaders in the field that were part of that book, and it did mention that it mentioned some of the most prescribed medications in sports psychiatry, and it put atomoxetine as one of those. Mm-hmm. Could you just, for the general public, tell them more about the medication and how it works, and then how it differs, and have you used this medication for athletes in ADHD in general?
I have used it, but I don't use it very frequently. But I think that is because of where I am. So Northwestern is academically an incredibly challenging place. And I also don't see people who compete in the Olympics very much, if ever. I don't think ever. And that's a different, so the the IOC has a much harsher standard, as like say or not harsher, has a much more stringent standard, as does, for instance, Major League Baseball League. It's a much more stringent standard. So, and the NCAA requires us to at least consider using a non-stimulant medication, because stimulants are considered potentially performance enhancing. As you can tell, can figure less distracted, more focused. There's a slight increase in cardiovascular ability. So stimulants are considered performance enhancing. And so I do prescribe Strattera. Strattera, just by anxiety and ADHD. And I think the consensus is that outside of sports psychiatry is that probably the stimulants are the first line of treatment. But Strattera works well. It takes a few weeks to work. It's a serotonergic agent. And I think the big caveat is if someone has liver issues, so it can be liver toxic. But the stimulants also carry a cardiac risk. So our athletes all get an EKG when they come to Northwestern. So in their initial, and then every year they get yearly EKGs, because of idiopathic hypertrophic cardiomyopathy and the few sudden deaths that there have been of athletes collapsing on the field over the history of the sport. I think, but like, let's say a high school student athlete doesn't get usually standard. It's not standard that they get an EKG. So that it's really necessary to do a thorough cardiac history, figure out whether there's any family history of sudden cardiac death, of cardiomyopathy, of arrhythmias, and if in doubt, get an EKG. And so, and for Strattera, it's a serotonergic agent. It's not like the stimulants you take, they work. It's more like a sleep or pain medication. The effect is immediate. If you don't take it, you don't have an effect. Strattera takes about 4 weeks to work. So you need to take it for a while, and then it works, and it needs to be taken daily. And it's a twice-a-day medication. So it's a little different setting, but there are many sports psychiatrists out there who would never start with a stimulant, who would start with a with Strattera, atomoxetine, or some of the other medications first. Now, most of the other medications, actually guanfacine, clonidine, and some tricyclics come to mind. Most of those really have side effects that athletes can't really tolerate. You don't want your blood pressure to be low. You don't want to have, anticholinergic side effects. Those are really very hard for athletes to tolerate. Whereas Strattera is well tolerated in general.
Okay, thank you.
Especially if athletes have substance use problems, just like everyone else, Strattera is a very good choice. And Wellbutrin actually too.
Interesting. And then also, I've kind of heard of the therapeutic exemption. Is that in the collegiate level that you have to deal with, or is that something that's just broadly dealt with in all fields of sports psychiatry? And if you could tell us more.
Well, so there is an exemption for the NCAA. So the NCAA requires any athlete who takes a potentially performance-enhancing drug to have documentation by the prescribing physician. Usually it requires, some vitals. And then how did you arrive at the diagnosis? What are the symptoms? What are the standardized instruments you use? So those are usually self-report and third-party report scales. The clinical assessment, how did you arrive at the diagnosis? And then comorbidities, you need to mention those. And as I said, ADHD is highly comorbid. About 85% of people with ADHD have a different psychiatric disorder at the same time. And whether you considered a alternative to the stimulant. Now the TUE, the Olympic sports, are a little different. They are, and I don't prescribe for Olympics athletes, so I looked this up. They gotta get a TUE from the World WADA, from World Anti-Doping Agency. Prior to competing international, they must undergo an annual review. They have to have, if it's a well-documented, long-standing diagnosis, the TUE can be granted for up to 4 years. However, yearly reviews by an experienced clinician are still recommended. So that's a more stringent standards. I don't think the yearly review is part of the NCAA standards. And I know that, for instance, Major League Baseball also has very stringent rules. I think they might even be more stringent than the IOC. Well, you can imagine that.
Oh, wow. Okay, yeah.
You can imagine that, if you're a Major League Baseball player, stimulants really would enhance your performance even if you don't have ADHD. So that's very strict.
I see. Okay, and I think you even touched about my next question. They're going to ask you, what are strategies you've tried, non-stimulant wise, like some of the medications you talked about earlier. And then also, what are, some behavioral strategies? Because we always in psychiatry like to mix the medication with behavioral strategies and therapies. What are some of the behavioral therapies and, strategies that someone with this diagnosis can apply now, or, they can listen to this podcast and start, looking into, before they start medications?
Yeah, so I know in the field of college psychiatry, there is one kind of non-medication therapy that has some research behind it, and that's group CBT. It's a manualized CBT group that helps students with CBT with ADHD. There has been research on mindfulness. There has been research on all kinds of things, on a lot of things. I would think coaching and CBT strategies and mindfulness are really the way to go. So there's mindfulness for attention issues as much as I don't know how familiar you are with mindfulness, but mindfulness really is about being able to acknowledge distracting thoughts, letting them go, and refocusing back, if you do the exercise on your breath, but it can be anything really. And that is, if you can learn to do that, that's a great way of dealing with distracting thoughts. A lot of the executive functioning issues, people really need to learn coping strategies. Some of my student athletes that have ADHD have a phone planner and a paper planner, and they're setting, 2 alarms for every meeting and 3 alarms for very important meetings. And they really they make sure their work surface is clean. Very difficult with the current remote learning environment, but they kind of try to get situational cues, like setting themselves up in the right way so that they can focus. I recommend working with a therapist and working on that, but even just if you Google ADHD coping mechanisms, you will find a lot of and ADHD mindfulness. You will find some exercises and just tips. And it's always important to make sure that those work for you. So one of the things, like some of the things for ADHD that I hear very frequently is put your keys and your wallet and your phone and anything important always in the same place in your house. Pack your backpack the night before. Make sure you have everything ready so that you don't run around for a half hour in the morning or for 20 minutes in the morning getting your stuff together. If you get a bill, pay it right away. Those kinds of things, because ADHD folks cannot put a bill like that's my bin and I'll get to it. They forget about it, right? So being very organized, very structured, lots of reminders for the executive function. And then, CBT is what has research behind it, but I'm sure you can Google and get to some stuff.
Awesome. Thank you. Yeah, that's all really helpful. I think anybody dealing with these issues could at least have a starting point. I know personally I use Headspace as like a app for mindfulness. So I think that's another resource people could use. My last question is, you have like a coach, a teacher, family member, teammates, noticing some of these symptoms. Sometimes, like, even dealing with our patients that have ADHD, they might not be ready to hear that, I don't have a problem, I'm fine, I have more energy than you. How can these parties go about, maybe discussing it or bringing it up to this party or patient or, teammate, to get them help?
Yeah, so coaches in particular, I think my biggest recommendation would be not to shame. So do not make the athlete feel ashamed for this. Having seen a lot of student athletes, I've heard a lot of coaching stories, and sometimes coaching styles can be very harsh, and that just leads to, you already have an individual that probably has lower self-esteem because they've had repeated setbacks due to the ADHD. So that lower self-esteem already can make their performance on the field harder, right? Because what you need on the field is enough confidence that you can be in this flow or in the zone and be do your intuitive best athletic performance, and you don't need to be in your head and thinking about everything you do wrong and work on your low confidence. No, shaming is the worst thing. And then I think modeling that you're open to getting mental health treatment is important for a coach or a parent or a teammate. Non-judgmental modeling, that's just something you get help for, just like you get help for your sprained ankle. That is very important. The kind of like, this is self-understood, that's part of taking care of yourself, that's part of making yourself be in the best shape possible to perform and to do your sport, which is usually what what athletes in general want. So that's very important. Often you don't have to say you have ADHD, even though that's what my athletes often tell me, their friends tell them. But just saying, you appear like really scatterbrained a lot of times. I've observed now, we called the super 3 times, the building super 3 times to open your door when I was, or you told me about that, or this is a 3rd time this quarter or this, let's say, school year that you forgot to submit your homework or to bring, I don't know, to get the signatures to go on the field trip for a high school student. Those kinds of things. If you can point them out neutrally and say, I wonder whether there would be someone who could help you with that, and then refer them to someone or encourage them to get help or encourage them to look it up or encourage to look maybe on, there's some really good websites out there for people to just get first information. There is the National Institute of Mental Health has a very good website under nimh.gov. The Mayo Clinic has a good website, but there is also, I think it's CHADD, maybe. It's an ADHD website. So where folks can just look up symptoms, maybe say to someone, hey, I noticed that you really have trouble with organization or that you daydream a lot. And I was wondering whether you'd be interested to look with me at this website or to look at this website if they don't do it together. But most importantly is not to make it negative. Because in the end, while we call ADHD a disorder and it carries a significant lower life expectancies, individuals with ADHD die in general. The MED study has shown that about 10 to 12 years earlier than a non-ADHD individual, probably not so much because of suicide or something, but I don't know, but my guess would be it's because of increased accidents. But so not so much talking about ADHD as a disorder, but as a neurotype, because when I talk to my students about this, I talk about it often as a disposition. And school is uniquely it's a non-welcoming environment for someone with ADHD, right? You have to sit still, you got to concentrate for hours, you can't move, you can't learn by doing. However, the work world is different, and sports might be different too. You might be that basketball point guard that has so much more of an idea what the field is like and is so much more spontaneous. You might be, in a job, you might be that, I work at a university, so I always say you would be a great trial lawyer, not so much someone who does legal research, but you will notice, rather than someone who's very focused, you will notice the jury's reactions and be able to adjust what you're saying according to that. You'll be a good marketing person, right? If you were in medicine, you probably wouldn't become a psychiatrist, but maybe an emergency room physician who has to juggle a lot of different things. Mm-hmm. And so to just, so there are parts in our life where someone with ADHD actually can perform very well. So less shaming, more like, let's figure out for you how to deal with this now. Maybe here you can get some information, modeling non-judgmental attitude towards mental health care in general. Remember, a lot of these individuals have comorbidities, so they might need something else. Adjusting your coaching style, using visual aids where you rather would normally just talk, using muscle memory, repetitive repeats of certain plays. I think, that's kind of how I would hope that people can deal with it.
Yeah, I think those are all good techniques, and I think that would be helpful for a lot of people. Well, this is Dr. Bettina Frankel. Once again, thank you, Dr. Frankel, for taking your time. Just let us know if there's any place we could contact you at, or if there's any projects or things you want to promote. Just you could give you the floor now to talk about those things.
Thank you. Well, I don't really. I think there's a lot of resources online. There's a lot of sports psychologists, sports psychiatrists, actually all kinds of folks who work in this field. And currently I have no project where I need anyone to contact me. That might change, and I will get back to you, Samto.
Okay. Thank you, Dr. Frankel, and thanks for joining us today.
Welcome. It's my pleasure. Thanks for having me.
Thank you so much for watching or listening to our content today. Please like and subscribe to our YouTube and podcast channels and share this episode with your friends and colleagues. Also, follow us at Sports Psych ISSP on Twitter and Instagram, or you can find us on Facebook as the International Society for Sports Psychiatry. Are you a medical student, psychiatry resident, fellow in a psychiatry subspecialty fellowship program, or a psychiatrist who has completed a psychiatry residency program interested in learning more about sports psychiatry? Join us and become a member of the ISSP. We have a free open source certificate of additional training in sports psychiatry program. For more information about our certification program, membership, or other inquiries, go to our website at sportspsychiatry.org.